Pediatricians and family physicians are usually the first health professionals to see children who stutter. Having a current and accurate understanding about stuttering and the options for stuttering therapy is a critical component in providing appropriate treatment referrals to concerned parents. Oftentimes, parents are uncertain of what symptoms really qualify their child as a stutterer. They present to you with a hunch that their child's speech just doesn't sound right. Defining stuttering as a communication disorder that is typically characterized by disruptions in the flow of speech that may or may not be accompanied by physical tension or struggle as the speaker attempts to produce sounds or words will help you to properly identify stuttering. Also note that individuals who have stuttered for a longer duration may experience significant negative emotions as a result of their difficulty speaking. We'll go into more detail on this in a few minutes. Before we discuss the causes, risk factors, diagnosis, and treatment options, let's go over some basic facts regarding stuttering. Stuttering usually begins in childhood between the ages of 2 and 5 years. It is 4 times more likely that boys will stutter than girls. However, it is also true that girls spontaneously recover more often than boys. Stuttering behaviors can vary throughout one's lifespan, with secondary behaviors that change or are intermittent. Overall, 1% of the whole world's population stutters. Now that we have an underlying definition of stuttering and its components, I'd like to address normal disfluencies in developing children. The types of disfluencies typically seen in very young, even preschool, children is normal developmental stuttering that is usually outgrown as time goes on. It is typical for a growing child who is experimenting and learning a complex language to present with some intermittent and minor stutters. Nearly all children go through a period of disfluency when learning to speak. The types of disfluencies the child may exhibit are sound or word insertions, such as like, or repetitions or revisions of sounds of words, or hesitations while thinking about what they want to say next. Children usually present these disfluencies effortlessly and without concern. In contrast, children who stutter present disfluencies in which the word units themselves are disrupted or fragmented. A child may repeat part of a word, for example, ba 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 bat, or prolong individual sounds as in shark. At other times, a child may have difficulty producing any sound at all. This is known as a block. Children who stutter often produce disfluencies similar to those observed in the speech of children who do not stutter. Although they oftentimes produce them more frequently, or they have increased physical tension, greater effort, struggle, or irregular rhythm associated with them. These associated features are an attempt to cope or prevent moments of stuttering in order to reduce negative reactions, either their own or from others. Examples of associated features include tightening of the muscles associated with speech, as in the tongue, jaw, lips, or chest, or even muscles that are not used for speech, as in the shoulders, limbs, or forehead. It is very common for children who stutter to start building negative attitudes about themselves and their speaking ability. That is why early intervention is so important. It's a vital step in preventing long-term physiological and emotional scars. Even though majority of children outgrow stuttering, early intervention can only help develop normal fluency. Deferring treatment may only solidify the habit of disfluency as the child continues to age. If the child continues to stutter into school-age years, it is more likely then that he or she will continue to stutter into adulthood. The best treatment is the earliest treatment because there is no cure once a child has reached adolescence. At that point, therapy only helps to modify behaviors or teach strategies to produce easier stutters. So whether you, as a pediatrician or a physician, are able to identify stuttering in a child or are unsure whether the disfluencies the child is presenting are normal or disordered, referral to a speech-language pathologist is appropriate. The sooner any disfluent pattern can be identified and intervention implemented, the more likely the child will bypass developing negative emotions regarding self and start developing fluent speech. This is especially important if the child has disfluent speech models such as a parent or relative that stutters. For young children, the treatment process includes educating parents about techniques for supporting the child's fluency, management of environmental pressures, and adjustment of speech models to help enhance fluency in their child. For older children, adolescents, and adults, treatment takes a more direct approach on speech production. Techniques used include management techniques such as slowing the speaking rate and reducing physical tension. reducing fear through desensitization exercises to minimize avoidance of speaking situations, and reduce negative reactions to stuttering is also incorporated in some therapy approaches. In addition to therapy, which focuses on speech behaviors, there are support groups to help children, teens, and adults who stutter develop healthy attitudes towards speaking and stuttering. Support groups provide a safe haven for discussing difficult situations such as bullying or teasing, and to practice speaking skills without being judged. Parents have also benefited from the opportunity to discuss their experiences and feelings with others going through similar situations. Stuttering is a disorder that can develop serious negative side effects if overlooked. It is so important to identify stuttering behavior as early as possible and to refer to a professional so that early intervention can be implemented as well. This presentation was intended to promote proper identification of children who present abnormal disfluencies and be informed when providing parents with appropriate referrals and resources in order to ensure their child receives the best possible care to restore fluent speech development. If you have any other questions, please ask a speech-language pathologist or refer to the National Stuttering Association's website.